Well, thank you, everybody, for joining us. We do have some very positive news for the healthcare system today. We are expanding nurse prescribing in the province. We are also providing an additional avenue for nurses who don't have the required hours for practice to get back into the nursing profession, whether it's a newcomer to the province or somebody who for a variety of reasons, either they took time to be with family or for illness or whatever the case may be. There's an additional avenue for nurses to get back into the profession with supervised oversight. The registered nurses will also have the ability to refer to specialists. So these changes, especially for the family care clinics throughout the province, or if it's a specialized clinic or in rural areas of the province, the enhancement of the scope of practice we will be announcing for pharmacists in the near future as well, but we're looking at all healthcare professions enhancing the scope of practice as was outlined in the Health Accord, which will provide a number of benefits to the people of Newfoundland and Labrador as we move forward and implement the recommendations of the Health Accord. Lynn?
Thank you, everybody, and we are really pleased to be here today and partner with government on these two exciting initiatives. The legislative changes to accompany these two programs starting is what we're launching partly today, but we've been working on the framework, the collaborating with partners, talking to different stakeholders and developing the pieces to launch these two very important programs which will increase access, will expand the scope of practice of registered nurses, and will certainly improve access to the people of Newfoundland and Labrador. So one program is registered nurse prescribing, and that program is, as the Minister said, expanding the scope of practice for those registered nurses who choose to take this program. So that's an exciting launch. And the second one is called our Supervised Practice Experience Program, which is a means for registered nurses to enter back into practice if they have been out of practice for a while, or are internationally educated nurses who have been in the province and again may have run out of currency of practice. So we're really pleased to be partnering with these two programs which really have a lot to offer the public. And as the licensing body, the regulatory body, we're really pleased that we can set up the structures and processes necessary to introduce these now at this point in time. Thank you.
Okay. We'll open it up for questions.
Mr. I guess I'll ask you first, the impetus for this, why the need?
Well, we've been working collaboratively with the College of Registered Nurses and the College of Practical Nurses as well. We've been working collaboratively with the College of Physicians and Surgeons. These changes are a result of the collaboration between our regulatory bodies, likewise the College of Pharmacists. We are enhancing the scope of practice for all healthcare professionals in the province. We understand that there's a shortage of healthcare professionals not only in this province but globally, and working in collaboration with our colleges, the regulatory bodies will help enhance the ability of Newfoundlanders and Labradorians to get the health care they need by the right person in the right place. So these changes are very welcome, very positive.
So, Minister, there's a shortage of nurses right now. How does adding on more workload for nurses end up improving access to care?
Well, there's a number of ways. First of all, if we've got a registered nurse in a rural area, they can now prescribe, for example, they can refer to a specialist. If it's a nurse in a family care clinic in an area of the province, that one nurse can still prescribe, can refer to a specialist. If it's in a clinic, a specialized clinic, they can refer to a specialist. So we don't necessarily need more nurses in certain areas of the province. That will certainly lighten the load for physicians, for example, in areas where we don't have a shortage. The other changes that we're making to the regulations to allow nurses who are out of the practice hours will help not only with newcomer nurses but with nurses that are in the province, should be able to get us additional nurses. We're recruiting in areas such as India and we expect, fully expect, to have hundreds of nurses from India come to this province. It should help in cases with those nurses as well in terms of prescribing and referring.
So walk me through how this new supervisory system is going to work. So if you've got a nurse who arrives from India today, what's that process? How long does it take? Walk me through that.
Yeah, thank you, and I'll walk you through with an example, but I will make a comment, though, on the workload, that in a number of ways, especially in probably more rural and remote or even in specialized areas, to work collaboratively with the team in order to be able to get a prescription or be able to get a diagnosis, nursing diagnosis, be able to order an intervention. This actually will help. So it will actually decrease workload for those nurses who choose. So I think that's an important point to appreciate. It's a choice and it adds on. How the SPEP will work, or the Supervised Practice Experience Program, is that it is a mentoring. It is a preceptor type of program where it'll work collaboratively with an employer anywhere in the province at any point in time when a nurse is identified as needing that currency of practice, needing to move forward, that they then will work with an employer, identify a preceptor, and basically work side by side on a nursing unit. So it is integrated within the employment setting.
So how long do they have to work side by side then before they can then actually get sort of a full license?
So from our standards, from our legislation, and what's considered safe, competent practice, there is definitions of currency, and currency is 1,125 hours in 5 years, or 450 in 2. So these nurses would have not worked for a period of time that exceeded those 5-year window. So what we're looking at is the minimum one, the 450. So this nurse will work alongside of another nurse in a healthcare system for the 450 hours. But only the first month, 135 hours of that is a direct preceptorship, and after that it can evolve into part of the orientation, part of the onboarding, and work collaboratively with the employer to determine what makes sense.
Mr. Osborne, what sort of timelines are you looking at in terms of getting these new amendments made and getting all this set in stone?
So the changes for the nurses that are out of their currency of practice will be more immediate. One of the benefits there as well, prior to this change, it would have cost upwards to $10,000, I think, Lynn, and 18 months to get back into practice for a registered nurse that was out of their currency of practice. In terms of prescribing, there are 3 modules. Registered nurses, while they're working, can partake in these modules, and we anticipate within a year they should be able to do the 3 modules and then have the ability to prescribe as well. Did you want to add to that, Lynn?
Yeah, we'll tell you, we have nurses signed up for both programs already. We have nurses started in the RN prescribing courses, and we also have nurses identified and getting organized now to start their supervised practice, both as registered nurses and, as the minister said, licensed practical nurses. It's a program for the supervised practice that will run for both groups. So there's lots of interest. There's and I'd like to do an invite to anybody out there who wants to learn more in the nursing world to reach out to us, because we'll only know about you once you reach forward. So yeah, there's lots of interest.
How many nurses are signed up for the programs? You say there's interest. How many are we talking?
Well, right now, both programs are at their beginning phases, like not even launched till today. So we expect it'll pick up. The first cohort for group of nurses going into the RN prescribing has a group of 20. The next, the SPEP program, looking at numbers, we could see possibly upwards of 200, but right now we probably got somewhere in that same number, that 10 to 15 numbers that have expressed interest that we know of. But we expect this announcement today will bring a lot more interest.
I'll ask you, how are the lives, I guess, of nurses? It's no secret that there's been a lot of challenges. It's been well documented. How is this going to help the lives of nurses, and I guess the workplace for nurses?
Well, This is a good news story. This is an opportunity to work to the full scope of practice, to work more in the team approach, have more independence and accountability without reducing any standards. So this is something that I think nurses who engage in the RN prescribing will be very proud, very pleased to do, pleased to help their communities and be able to do things effectively and efficiently. So I think this is a real good news story for the nurses that are out there that maybe for some reason, as the minister have indicated, haven't been able to work. Maybe they had took time off to care for a loved one, or maybe, an illness themselves, and want to get back into the profession. So this is something people are proud of, being a registered nurse. And so the ability to come back, have a pathway, as indicated, to be able to come back is huge for people's morale. And, of course, we need numbers. So I think, and we need the full scope of practice. So I think they're both really good news stories.
I just want to get a sense of what sort of things will an RN be able to prescribe for? Give me a general,
Keep going.
And what won't they be able to?
Well, it's starting, so it's important that we start everything with a framework and guidelines and an introductory level to be able to monitor it. But it will be designed to be likely unit type of or program type specific. So we have nurses that practice in diabetes education, and they will alter medications and order different diagnostic tests. So that's a very likely a very starting area. Wound care is another area where nurses are very actively engaged in, and then have to collaborate with individuals, which they still will do. They will still be part of a team, but they'll be able to independently do things. We have clinics out in public health, sexual health clinics that are out in different areas. Women's health is another area where maybe just doing some diagnostic tests and procedures. Communicable disease control. Lots of opportunities where there are areas, even genetic treatments and management. So these areas where nurses now probably work tight in a team, see clientele, have specialized knowledge and experience. They would have to have experience in the area, and they would be able to expand upon that and work through this. It is totally different than a nurse practitioner. A nurse practitioner is a wonderful part of our team, an autonomous, independent group of practitioners that can work without any limitations just beyond their competency. This will start in small areas, so it's a combination of a partnership. That's how it will be determined. Where does it work in the employment setting? Where does it work that there's a need and there's a team and there's availability? So it might be different in different parts of the province.
What does this the average person that maybe just wants to get antibiotics or something like that, is that something that nurses would be able to prescribe?
Yeah, it's designed around nursing care and nursing and a holistic care of the client. So basically what it would mean that if that nurse is in that area, that makes sense, then yes, it could be. But it's not like line up for a prescription. It's not that style. It is within an employment collaborative type of team that would be there. So if they work, say, in one of those new family care teams, and they were the most responsible person, as the minister has said, to see the client, the client comes in, and they determine that meets whatever that group agreed to, then yes, it is possible.
What does this mean in terms of, speed, in terms of getting prescriptions done? Because I guess essentially with this, adding this to their scope of practice, you're taking out an extra step. So what will this do in terms of speed and getting these prescriptions completed?
So just one example, if you're looking at a family care team, for example, if an individual is seen by a nurse, because when they come in they're triaged, it's determined the most appropriate care provider. The family care teams are multidisciplinary. You've got physicians, nurse practitioners, registered nurses, social workers, mental health and addictions folks. So if they're seen by a nurse, as opposed to the nurse making a recommendation then to a nurse practitioner or a physician that they feel an appropriate prescription would be needed, a nurse would be able to provide that prescription, cut down on the wait time for an individual in the family care team, as opposed to either having to then be escalated to a nurse practitioner or a physician, or having to make another appointment if the availability wasn't there on that particular day. So it will provide a better service to the individual. It will expedite the process. The nurse, in many cases, is aware and understanding and knowing what prescription would be required and would make that recommendation to escalate it to a nurse practitioner or a physician. The other aspect of this as well, and working collaboratively with the college, as this starts to roll out and we get the registered nurses who have an interest in doing the modules and looking at this, we are looking at ways of introducing it to within the course load and the curriculum in our Centre for Nursing Studies as well. So in the future, nurses that want to have the ability to prescribe as they're going through their normal course load can take additional curriculum and come out prepared to prescribe.
You said earlier that the scope of practice obviously is today's nurses and it's pharmacists to come. Can you tell us a little bit about when that'll be and what some of the details of that top secret right now?
Well, it's not top secret. I've hinted enough at the fact that we're going to be changing the scope of practice for pharmacists. But I think I'll leave the goodies in the announcement for when we actually make the announcement, and that will be in the very near future.
Newfoundland and Labrador is our first province to give these prescribing abilities to nurses. Ontario's been doing it for 6 years. So why is it taking this long for it to be introduced here?
Well, working collaboratively, and again, I mean, the college and the other regulatory bodies understanding the challenges that we're going through in terms of a shortage of healthcare professionals have been very cooperative in working with government and trying to find and create not only the opportunities but the solutions that are required. So this is something that has been looked at and contemplated for some time, but over the past number of months we've really escalated the work that was required and making the changes to the regulations to allow this to happen.
Will nurses be able to do this within a hospital setting? I know like some other provinces prohibit nurses from being able to prescribe in a hospital. Is there any similar procedure?
Yes, I mean there's a number of areas, especially if you look at our Category B sites, for example, or a family care team clinic, or if, as Lynn had pointed out earlier, a clinic where we're dealing with diabetes or other specialties, they will be able to in those settings. So, Lynn, did you want to add to that?
Sure. I mean, as I said, it's going to be a collaborative decision amongst the team that are in the area. So if I use women's health again, could be something in the case room or obstetrics or areas like that. That makes sense. So again, it's what the employer would determine with the team and with everybody that makes sense to make things effective, and efficient. And so we'll see where it will expand. I expect it'll start in smaller areas, but I anticipate it will expand. And to the comment about why so long, there's lots to learn, lots of evaluation data. We are starting this program based, on the information we have gained, the evidence we have heard, the suggestions for improvements that have come forth, and we're starting this on a wider scale. So yes, it might start in a unit, but it's not restricted to a unit. So we've learned from the lessons of different areas and talked with all of our stakeholders and collaborated on the development of this, and we're quite excited that this is not an inch-by-inch program. This is launching a program for success, and as the Minister indicated, we do anticipate down the road, as any initiative, any progressive initiative like this, we're constantly evolving the curriculum of our nursing education programs through Memorial, and we certainly will be having discussions about how this fits in, again, as we evaluate it and learn and grow.
I want to get a sense, you've talked about this within a team sort of environment, but what about places like the North Coast of Labrador, where a registered nurse is the sort of only healthcare provider in that community? How will that work?
So I know Lynn can speak to this as well, but that goes back to your question earlier. There are communities where we have nurses, registered nurses, that are able to take on the prescribing role as well and provide a much better service to the community that they're representing. That's one example. We've got Category B sites. For example, if the community doesn't have a physician, if a nurse practitioner is not available on a particular day, the registered nurse will be able to prescribe. Prescribing is also available through 811, which some people are still not aware of, but prescribing is available through 811. But we do have Category B sites that there are times that if there isn't a physician or a nurse practitioner available, this extra function by a nurse, and we have a complement of registered nurses. We have sufficient registered nurses in some of the locations. They can take this role on as well. So it will enhance the service to individuals throughout the province. It will provide better service to the general public. We've consulted with the Registered Nurses Union, and this is welcome news for them as well. I think they've been waiting for this for some time. So this is certainly a good news story. We look at a community such as Bonavista, for example, and I will say a little plug for the new program we just come out with. In addition to the 2 full-time and 1 half-time we had in Bonavista, it looks as though we've recruited an additional 3rd doctor for the Bonavista area, and it is one of the doctors we spoke to on our trip to Ireland. One of the signs of success from that recruitment trip as well. And then did you want to add to the...
No, the only thing I'll say is that, our technology has certainly advanced, and we have virtual connections everywhere, not just telehealth, but virtual, e-consult is a program that is run, through the medical group that you can reach out, you can find someone. So yes, they might be alone up in name, but they're not alone. They have a team around them. They're making a lot of independent, and God bless them. They're fantastic nurses all over the province in all these areas and are a big part of the community. But this day and age, we're really pleased that there is a team accessible through the virtual services. So I still believe there is that support there. Maybe it's not on the ground right at the moment, but there's certainly supports available. So the team is around the province everywhere.
Will nurses be able to order tests?
Yes. That's an important part of a plan of care. It's not just line up and get your prescription. It's assess the client, determine what their needs are, and that will likely involve diagnostics, and it'll also probably involve what we call non-pharmaceutical products. So it might be different wound care products, or it might be an oxygen piece of equipment or something like that. So yes, they will be able to provide total care for the clients in that particular area and that particular stream that they're working on.
You mentioned that this is going to be completely different from an LPN. It's sounding very, I think for most of the public, one of the big differences has always been that the ability to prescribe. So we're now giving that to RNs. Can you explain what's going to be the big difference between an LPN and an RN?
A nurse practitioner.
Sorry, yes.
Yeah, so licensed practical nurses are a critical part of our team as well, but from a regulatory body, we license RNs and nurse practitioners. I think the nurse practitioners, there's a number of differences. They are certainly graduate prepared, and this is a part of their program of study. So they would go through their whole nurse practitioner program, being prepared for an independent, competent and safe, but an independent, autonomous role where they would actually could see the clients that they serve. They still will work in teams, but they're not dependent upon the team to be a part of the structure. They are, autonomous. They could, set up, different structures and processes for the way they see clients. So it is different. There's no limitations at all. We are starting with some limitations on registered nurses in this, as a beginning and an evolution, for example, around research protocols and things like that. Nurse practitioners wouldn't have any of those restrictions on them. And there are some medications that require higher level investigations, working in a different way. So those are our system controls to just ensure the quality and the proper assessments are done. So it is different, but it is an expanded scope, and all nurse practitioners are registered nurses. So I think they're engaged and excited to be a part of this team too.
And the scope of practice for a nurse practitioner is larger than the scope of practice for a registered nurse, even with the prescribing. And as we look at increasing the scope of practice of all of our health professionals, nurse practitioners will be amongst the group of health professionals that will be looking at the scope of practice as well. Okay. Thank you, everybody.
Thank you.